so they don't have to wait with the other patients in the waiting room, a special ultraviolet treatment room with its own special air conditioning system, so even in the middle of the winter when it's cold outside, the ultraviolet machine creates heat, and this way that room can be kept cool all year round. The office also has a nice room for medical records, conference area, and a little nice private office room for myself. So I'm truly looking forward to the office project. They say construction can take anywhere from 4 to 6 months, and I urge you to stay here and watch us as we go ahead and do more progress on the new Skin and Allergy Medical Group building. I'm truly looking forward to being able to offer the citizens of Yuba Sutter the most modern and up-to-date treatment facilities for skin diseases, skin cancer, and all allergic diseases at the new center. Feel free to drive by and watch construction as it takes place across from the Sutter County Health Department. Now, on with the Medical Explorer. On a previous Medical Explorer program, our community's most highly trained specialist in the field of heart surgery, Dr. Timothy Sloan, performed actual pacemaker heart surgery. Pacemakers are used when the heart is unable to beat fast enough or regular enough to meet the body's demand for blood flow and blood pressure. Tonight, Dr. Sloan is going to show us what happens to patients after they've undergone pacemaker heart surgery. Let's leave the studio now and explore Dr. Sloan's heart pacemaker clinic at his office in Marysville.
Dr. Peppercorn, welcome to my pacemaker clinic.
It's a pleasure to be back with you, Dr. Sloan. I'm looking forward today in seeing what actually goes on with patients after they've had their pacemaker put in. Could you begin by showing us a little bit about what the pacemakers look like and how they're working and the way they go in the body before we get to your patients?
Sure. As you recall, the last time when we talked about pacemakers and how we put them in, we actually put one in. Now, as you recall also, in 1971, we had pacemakers that were this size, and you can see how large they were at that time. This is standard single-chambered pacemaker. Nowadays, we have pacemakers that are this size that do not only the same function, they last longer, and they actually do more things than this one did in 1971.
That uses a lot of the new computer technology with microprocessors and
Absolutely.
things like that. Right.
Okay. Now today, as we showed you in the past, the pacemaker has two functions. It receives electrical pulses from the heart, and it sends off pulses when either the heart's not working correctly. The wire, which is an important part of the pacemaker, is put down through the vein into the right side of the heart.
So that's done without actually cutting into the heart. That's done through the blood vessel itself.
That's right. Mm-hmm. And the first patient you'll see today only has one wire in. It's a special type of pacemaker, specifically for him. There's another type. The second gentleman you'll see has two wires, one into the right lower part of the heart and one into the right upper part of the heart.
Now, while we're looking at that, it's interesting. The electrical impulse comes down through the wire and actually touches the heart muscle.
That's right.
How does that electrical impulse spread through the heart? Maybe you can just show us with your finger here what happens.
Well, there is a conduction system or electrical wiring of the heart. It receives, the impulse starts from here, goes all the way down through the center part of the heart called the septum, and the nervous impulse goes both to the right side and then over to the left side. This is exactly what sometimes happens in our patients, in that the top part of the heart does not talk to the bottom part of the heart because of the way station here and or here.
You've explained on a previous program that pacemakers do different amounts of work as they're inside the human body. They're sensing, they're giving the electrical impulse. So the exact time that a pacemaker battery will last depends on how much work it has to do.
That's right.
But what's the average? How long does a usual pacemaker battery survive?
It's very difficult to tell. Depending upon how much you use it, sometimes they last anywhere from 5 to 10 years. That's another thing that we do at the pacemaker clinic that is not done in hardly any other office in the area, and that is that after 3 months and the patient's pacemaker is working fine, we then reprogram it without going back to surgery, and save energy to that particular pacemaker, and thus prolonging the effective life of the pacemaker itself.
Excellent. Well, I understand I can hear them talking outside that your patient's ready to come in, so I'm going to step out and let you actually work with your patient today here at your pacemaker clinic.
Fine. Now, Mr. Williams has had a pacemaker in since 1972. He's had actually 4 or 5 different pacemakers. His first one was put in Washington, and it was for the lower part of his heart not working fast enough. He has had different pacemakers put in Northern California, and he is very similar to what I described just previously, in that 1 month we were doing a pacemaker check and everything was working fine, and the next month he was feeling fine, but the pacemaker was not functioning correctly. He also has brought in his, what we tell all our patients to do, is bring in their pacemaker card, which is this card which is given by all the companies, and it tells the model number, the date that it was put in, and the type of lead or the wire that was put in. Chrissy is taking his blood pressure, which we do. We do pacer clinic just like a mini doctor's visit. It's important to see what their blood pressures are, and if they're too elevated or too low, then we inform the physician.
What happens if the patient misplaces their pacemaker card?
All they have to do is call here. We call the company, and the company replaces it for free.
What if you were in the emergency room and a patient came in with one and just had no idea who to call? Could you get that information by x-raying the patient?
First off, the most important thing is doing a chest x-ray, because every pacemaker looks differently under x-rays. And after looking at that, plus utilizing one of the books that we have here, we are able to identify exactly what type of pacemaker it is. We use this apparatus to see how well it really is working. She'll put it on his chest. Okay. We are now seeing a readout of the patient's own electrical activity here. That means the pacemaker is sensing properly, the computer is working properly, and this is a pacemaker spike, which means that the heartbeat went lower than the programmed rate, and the patient's pacemaker worked. And it's sensing and pacing correctly. This is his own heart. That's the pacemaker electricity. Okay, this is a programming head for the specific pacemaker. And what we're doing at this particular time is asking the pacemaker specific questions, exactly how well it's functioning. So after we get it positioned properly, we then push the button and we find out many things about it. How fast it's going, whether it's sensing or pacing, how much energy it is using, and how much electricity is given per beat. So even if we did not know what it was set out by another doctor, we can ask it questions, and it will give us the answers what it was programmed last.
How can you tell how much life is left in the battery of the pacemaker?
In this particular pacemaker, it says battery voltage status okay. That means that the battery has no indication of this time of wearing down. Basically, that's the major part of the pacemaker check in a standard ventricular single-chambered pacemaker.
Dr. Sloan, I'd like you to show us exactly where the pacemaker rests under the skin and what type of scarring occurs after pacemaker surgery.
Bill is a little bit different in that he's had many pacemaker surgeries in the past, as I mentioned. This is a previous scar, this is a previous scar, and this is the scar where this pacemaker is that I made is this long, and the pacemaker is sitting between here and here and here and there. So the actual incision is quite small nowadays, and there's no change in the shape of the chest just because you have a pacemaker in. With the newer pacemakers, there's even much smaller change in the chest wall.
Sir, how does it feel to actually have that pacemaker inside you? Do you feel it being in there?
No. Never paying any attention to it.
So you really don't know anything's really in there unless you actually feel the skin right underneath.
So, first one, he asked me where I wanted it put. I told him I'd like it on this side because I like to shoot pheasant and ducks and so forth, and I didn't want it to get in the way of the shotgun.
Does it interfere with anything now?
No, nothing.
How's your shooting doing?
Lousy.
But not from the pacemaker.
No.
Oh. Well, I was pleased today to recognize one of my very well-established patients, Mr. Duffy. Thanks for coming in today. This is great.
Thank you.
Actually, it's interesting. We had talked several years before you had your pacemaker put in, and I remember your wife coming in and telling us how you were really feeling run down and very low and feeling terrible, and you went to your general doctor and he found that your heart wasn't working properly.
Right. That's who it was.
And they sent you over and had a pacemaker put in. How's it been since then?
Well, it's getting along great. Just really great.
Do you actually feel anything inside?
Oh, nothing now. No.
Well, Dr. Sloan tells me he's ready to check it out for you, so it's really good seeing you, sir.
Fine. Nice to see you.
Thanks.
This type of pacemaker is a little bit more special in that it does have two wires, one going to the upper part of the heart and one going to the lower part of the heart. We have now asked the pacemaker some questions. It not only told us what the model number is, it tells us even what the date was that we asked it the questions. It tells us what the pacemaker was programmed at and other important sources of information that we need. We will now ask it some additional questions. Push the button, telemetry. We're getting additional information, and in this particular type of pacemaker, it will tell us the amount of energy it is using, and it will even tell us how much is left over. Okay? Also, with this type of pacemaker, it will tell us whether the upper part of the heart was working or the lower part of the heart was working, or that none of the upper part or the lower part was working adequately, and it told us how many times, 1,653,000 times, since the last time it was checked, that the pacemaker was actually functioning. This gives us a better way to program the pacemaker to that particular individual. In Mr. Duffy's case, what we've done is we've turned down the pacemaker down to a very low rate to see if his pacemaker was still needed. And indeed, it shows that this is his own heartbeat, but the distance between here and here shows that his heartbeat is going less than 40 times a minute. And that's when the pacemaker kicks in. And now what we're going to do is reprogram his pacemaker back to where we had customized it to his own lifestyle. And I want to show how easy it is to program a pacemaker, and that it doesn't hurt, and it's much changed from pacemakers in the past. As you can see, not only can we program the pacemaker, but the pacemaker came back and said through the programming head that indeed the pacemaker has been programmed adequately, and that the pacemaker is functioning exactly as we said it. And indeed, you can see that the heart rate has picked up only because it is the electrical activity of the pacemaker is being seen here. It also shows that the upper part of the heart is working fine, and the lower part of the heart is requiring a little assistance from the pacemaker.
Well, Mrs. Duffy, how long has Mr. Duffy actually had the pacemaker inside?
Well, almost 2 years.
2 years.
1 year and 8 months of that.
When he needed it, what was going on? How was he acting before the pacemaker was put in?
Well, he just didn't have any energy at all, and just was tired all the time, and just not like him, and to sit down.
Has he been as good as new ever since?
Good.
Even as good as when he was 18?
That's right. Well, I didn't know him quite 18.
Well, you look pretty good to me, Mr. Duffy. Thank you again, and Mrs. Duffy, thanks for coming over with us today and being on the Medical Explorer. Before we close tonight, I'd like to tell you about some new developments in the area of pharmaceuticals, medications, in dermatology. The latest news, as reported in the national news, cable news right here on cable TV, is vitamin A. Vitamin A, as you know, has been used by many people to improve their skin, improve their eyesight over the years. Really hasn't done very much. We need a certain amount of vitamin A in our body just to survive minimum daily requirements that the government will set for us. But if we take too much vitamin A, that's the pure vitamin A, we get into big problems with liver irritation in the body, loss of hair, changes in the skin. So the companies that put together vitamin A have been able to change vitamin A in little ways and make other products that are helpful for the skin. And the first development was Retin A. Retin A is a product that became available in the 1970s in the treatment of acne. It became very powerful to help blackheads and whiteheads in treating acne. Well, lately, just during the past 2 to 3 months, there's been new evidence to show that Retin A cream, just the cream itself, might be helpful in treating some of the sun damage changes that the skin gets from being in the sun over a period of 20 or 30 or 40 years. So we know by applying this, we can sometimes now help wrinkles and help sun damage, and this is something you may want to ask your dermatologist about the next time you go in to ask questions about something. Well, the company that made Retin A said, well, let's go ahead and make something else with vitamin A. Maybe we can do things with internal vitamin A derivatives that's even more powerful. And that's when they came up with Accutane, cis-retinoic acid, a derivative of vitamin A, not the same thing. You've heard before on this program that this drug, Accutane, can cure acne if taken for about 5 months, and it can. 2 out of 3 people who take Accutane can be cured of acne. But the drug has many very powerful side effects and has to be used very cautiously with the patient and the dermatologist working together on a monthly basis during the 5-month period of time. But what's new on the horizon is taking Accutane, this derivative of vitamin A, and changing it into another vitamin A derivative called atretinate. Atretinate will be a new drug available hopefully before the end of this year to treat severe psoriasis, the disease that causes scaling all over the body with red patches. And we're looking forward, hopefully, to getting this approved from the government by the end of 1986. The drug is atretinate and may be the latest treatment and the best treatment for severe disabling psoriasis. I have to thank Bob Church for letting me come over to his pharmacy and taking a look at all of these products over here. I'm not sure I'll thank that cash register over there making all that noise. I'd like to thank Dr. Sloan and his patients for allowing us to learn more about life after pacemaker heart surgery. Office facilities like the one we've just seen keep our community at the most modern forefront of medical care. We hope to have Dr. Sloan return for a future Medical Explorer program and actually show us actual lung cancer surgery. You can keep up with these latest happenings and developments in medical care in Yuba City and Marysville by joining me here on the Medical Explorer every Tuesday and Friday evening. Well, that's our program for tonight. I'd like to invite you to write to me at my dermatology and allergy office in Yuba City with your suggestions for areas and people that you'd like to see here on this program. The Medical Explorer, as you know, is a public service program, and I really do want to hear from you with your comments and suggestions. Please write to me at the Skin and Allergy Medical Group of Yuba City at 367 Del Norte Avenue, 95991. In my next program, The Medical Explorer will take you behind the scenes of more interesting frontiers of medical care practices in the Yuba City, Marysville area. Till next time, I'm Dr. Robert Peppercorn, your Medical Explorer. Thank you for joining us tonight, and have a good evening.